It appears my transplanted hairs seem sparse. I am not sure if it looks like there are enough covering the area. My doctor says that those tiny dots in the picture provided are also transplanted hairs, and not all of it will be able to stick out. He did a forehead reduction and had grafts placed in my natural hairline as well, so it all flows together well. I am just worried looking at it as is, if it would end up looking sparse or healthy and dense as I'd like it to. He said don't worry, but I am and would like a second opinion. Thank you.
Thank you for your question. You submitted your question with a single photo, and it seems like you've recently had both a forehead reduction as well as hair transplant, and you are concerned that the density of hairs is not going to be as good as you hoped for. And you stated in your question that you checked in with your doctor, and your doctor said that several of the dots in the scalp represent hairs that aren't necessarily sticking out. So you're looking for additional thoughts. Well, I can certainly share with you reflections about patients who we've treated like yourself in our practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Hair transplant has been a significant part of my practice. I'm also the founder of TrichoStem Hair Regeneration Centers, a system we developed to non-surgically treat male and female pattern hair loss using a material called acellular matrix with platelet-rich plasma. So certainly this situation is not unfamiliar to essentially, I would argue, every hair transplant surgeon. And it is understandable to have these concerns, particularly when you look at the grafts that were placed. I think that one of the things that I've always tried to communicate with patients when we were doing a lot of transplants was essentially how transplants are done, and I would essentially draw squares on the scalp in the areas that were going to be transplanted and say that we can at maximum put maybe 20 grafts per square centimeter, and then look at the donor area and show what's being harvested. Mathematically, objectively, it always made sense. Patients would sign off and understand, but then would come the fear of whether or not the transplanted hair will have the level of density that they would hope for. And I've always told my patients that there is an upper limit to how much density you can have with a single transplant, because the more you try to crowd the grafts, the higher the rate of grafts that will not make it. And that is important because your donor area is a limited resource. Now, your doctor has, I'm sure, had a similar discussion with you, and generally speaking, it is understood that it takes about a year, if not longer, to fully see the full growth. We've actually helped a lot of patients who have had transplants done elsewhere. Alluding back to what I was discussing earlier about hair regeneration, hair regeneration is a system that we developed that evolved out of hair transplant. We wanted the maximal growth of our grafts, which we worked so hard to place, as well as the healing of the donor area. And we were able to observe that thinning hairs actually became thicker that were not directly hair transplanted hairs. So from that evolved this system called hair regeneration over the past 7-8 years, which we've used to help men and women with hair, pattern loss, particularly in areas which are not good transplants candidates. Basically, whenever you have decent density but not significant coverage, it's a challenging area to transplant, and we were able to figure out that if we are able to reactivate hair that isn't growing, thicken thinning hair, prolong the longevity of existing growing hairs, well, then the coverage can actually be as good as a transplant, if not better than 2 transplants. Basically, it's a function of effective coverage depending on density as well as the caliper of individual hairs. Well, we've also been able to take this same technology and apply it for patients who have had transplants done elsewhere. Generally speaking, somewhere between the second and third month, we can do an injection to help stimulate healing and improve the quality of the existing hair. And in addition, it appears that the transplanted hairs start to grow sooner. And I would theorize or hypothesize that there is some value in improving the quality and the survivability of those transplanted hairs. This is not an absolute, but it's based on my clinical observation with the experience that I have doing hair transplant. That being said, I think that you still have a lot of time in front of you before you can draw any conclusions, and no intervention will make surgically will be of any significance benefit in the short term. You basically have to wait to see how well those grafts heal and what the outcome will be. It is well known in our specialty that in a survey of members of the International Society of Hair Restoration Surgery, that 65% of people after transplant did feel that they wanted more density. And that's not in any way a reflection on the quality of the surgery, but rather the reality of the outcomes that are desired by the patients and the limitations of what a transplant can deliver. So there has to be always a meeting of the minds as to realistic outcomes and maximal results that are somewhat, of course, depend on the technical execution of the surgery, but also on the limitations of wound healing and the viability of transplanted hairs. I often told my patients that if you're considering a hair transplant, well, be prepared to do two, because it is typical to need more than one for most people who are ready to have a transplant. This motivated a lot of the work that we've done with hair regeneration, where anticipating the progression of hair loss and trying to treat before you need transplant has been essentially the core approach to hair thinning that we have been employing now for patients who come from around the world. So I think you need to, as I always recommend, maintain good communications with your doctor, see your doctor for follow-ups as is scheduled, and just wait this out to see what ultimately happens, and understand that this is a reality for not just you, but for, I think, at least 65% of patients who undergo hair transplant. So I hope that was helpful. I wish you the best of luck. Thank you for your question.